Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
You feeling numb now?
Yes.
You feeling numb on your lower lip all the way up here?
Yes.
How about your tongue?
It's numb too.
Feeling numbness, huh?
Mm-hmm.
Okay, fine. Now listen, we'll try to make this as comfortable as possible. Extraction is kind of a traumatic thing for you when you think about it, but really it's not that difficult. And you'll feel some pressure, and you'll hear some strange sounds, some clicking, some popping kinds of sounds, but you won't feel any pain at all. This numbness will take care of any pain that you have. Okay?
Yeah, boy, I don't feel so good.
You don't feel good? How do you feel?
I feel like I'm going to throw up.
You do?
Yeah.
You feel nervous?
Very.
Let me see how you're doing here.
My hands are cold.
You feel cold. Nancy, would you get a blanket for us, please? Terry, I'm going to set you down here a little bit, tilt you way back. I think you'll feel a lot better. Just cover her up real good there, Nancy. Get your head way down here, and we'll just let you relax for a moment. That's fine. And we'll raise you up to our size. There we go. Just keep you right there and relax for a minute. How are you feeling now, Terry?
I feel a lot better now.
Feeling a little bit better? The coldness gone out of your hands?
Yes.
You think you'll be able to go on with this today?
Yeah, I think so.
Feeling well enough to do it?
Mm-hmm.
Okay, fine. We'll set you up here and then we'll get started. There we go. We'll get you uncovered here.
Could I ask you to remove your glasses, please?
Certainly.
Hi, Kathy. How are you?
Fine, thank you.
How's the family been?
Fine. Oh, by the way, before we begin, could I please have a drink of water? I've been so thirsty lately.
Sure, you sure can. Been drinking a lot of water?
Yes, it's just this past week. I don't know whether it's the weather or what, but I've been so thirsty, and then I get a drink, and a few minutes later I have to run to the bathroom. And
Drinking a lot of water lately, huh?
yes, I can't pass a drinking fountain without having a good drink. Thank you very much. Oh, that's good.
And it goes right through you, so you have to go to the bathroom a lot.
Yes, I really do. Yeah, it's been a
Have you
problem.
noticed any other changes in your system at all?
Well, I've been very hungry lately, especially the past week, and it just seems like I eat a lot, but I've been losing weight.
Just keep on eating a lot and not gaining any weight.
Right, in
but
fact,
you're
I'm
actually
losing, yes.
Actually losing weight.
Yes.
You have any other problems, any cuts or sores or anywhere in your body that aren't healing? Or
Well, I do have a little sore inside my mouth that doesn't, I'm wondered why it hasn't healed up. It has been a long time, longer than usual.
a week or two or something
Yes,
like that?
about 2 weeks.
About 2 weeks. Have you ever had any history of diabetes in your family at all, and any of your relatives?
My father and his sister, my Aunt Sarah, both have diabetes. In fact, they're on insulin.
You know, I think that we ought to send you to your physician and have this checked out a little bit before we would go on with any dental treatment, because you're showing some pretty strong indications that you
really?
might have diabetes, and I'd surely like to rule that out with the indications that you're giving me.
Well, would this really be necessary? I'm here, I've made the appointment. I'd kind of like to use the time that I've...
Well, I can appreciate that, but I think that because of the fact that people that do have diabetes run a greater risk of infection than
really?
those without. I would rather not run that risk, and I would rather have this question settled and just to protect you. I'm not certain that you have diabetes, but I think it would protect you if we delayed dental treatment till then.
Well, it sounds like a good idea.
Okay, we'll
I'll do
reschedule
that.
you then for another day.
Well, Bob, if we didn't get any work done today, I suppose we better get going.
Let's go.
Doris, you want to get the anesthesia? We'll freeze that area up for you.
Something burning?
Doris, I think Mr. Jones is having a seizure. You want to assist me in gently restraining him? I'll be sure his airway's open. You want to get me the tongue blade, please? Be sure never to enter your fingers into a mouth. You lose them in a hurry. This should be self-limiting in 2 to 3 minutes. Okay, he's coming out of it now. Just relax. Gently restrain him. Doesn't take force. Keep him from injuring himself. That's the main idea. Okay. Okay, Mr. Jones. All right. Did you notice that Mr. Jones mentioned the idea that he smelled something just before he went into his seizure? Perhaps you should try and contact his wife now, because Mr. Jones is going to be rather drowsy, what we call post-ictal.
Anesthesia, please. Here, just tip your head back here just a little bit. Breathe. You feeling a little upset here? Hmm?
I feel like pins and needles around my mouth.
How about your fingertips?
They feel numb.
Nancy, would you get the headrest cover for me? Sue, set your head up here for a moment. Okay, just set your head back. We're going to put a bag over your face here, and we'd like you to breathe slow and deep into the bag. Slowly and deeply. Slowly and deeply. You feeling a lot better now, Sue?
Yes, I feel fine.
Is the numbness gone out of your hands?
Yes.
Good. You think you'll be able to go ahead with our procedure today?
Yes.
Okay, fine, Nancy, let's go ahead then. If you feel uncomfortable, just let me know, all right?
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.